CABG, coronary artery bypass grafting. Coronary artery bypass grafting or CABG is a cardiac revascularization technique used to treat patients with significant symptomatic stenosis of the coronary artery or its branches. The stenosis segment is bypassed using an arterial, for example, internal thoracic artery, or venous, for example, great saphenous vein autograft, re-establishing blood flow to the ischemic areas of the myocardium. Indications. Indication for CABG is established after careful consideration of the clinical features, coronary catheterization findings, cardiac function, and the patient's general condition. High-grade left main stem coronary artery stenosis, significant stenosis greater than 70% of the proximal left anterior descending artery with two-vessel or three-vessel disease, symptomatic two-vessel or three-vessel disease, disabling angina despite maximal medical therapy, poor left ventricular function with myocardium that can return to function on revascularization, post-infarct angina. Indications for emergency CABG, non-ST segment elevation, myocardial infarction with ongoing ischemia that is unresponsive to medical therapy or PCI, STEMI with inadequate response to all non-surgical therapy, significant ongoing ischemia, traumatic complications, or threatened occlusion in STEMI after a failed PCI or previous CABG. Main indications for coronary artery bypass grafting: significant stenosis of the left main coronary trunk, significant stenosis of the proximal left anterior descending artery, triple vessel disease, 1, 2, 3, triple vessel disease. Contraindications. There are no absolute contraindications for CABG. Relative contraindications include asymptomatic patients with a low risk of myocardial infarction or death, comorbidities, for example COPD, pulmonary hypertension, systemic disease, advanced age. People advanced in age have more perioperative complications, but still CABG can increase the quality of life. Types of CABG: traditional CABG using cardiopulmonary bypass machine, off-pump coronary artery bypass surgery. This is done on a beating heart. Minimally invasive direct or totally endoscopic CABG. This is also done on a beating heart. Vessels commonly used in coronary artery bypass grafting. Both arterial and venous grafts may be used for CABG, but arterial grafts have a better prognosis and patency rate than venous grafts. Common grafts include internal thoracic artery, radial artery, great saphenous vein, small saphenous vein. Arterial and venous grafts used in coronary artery bypass grafting. Arterial graft, for example, internal thoracic artery, is grafted on left anterior descending artery, bypassing the stenosed patch of proximal left anterior descending artery. Venous graft, for example, long saphenous vein graft, it is grafted here on posterior descending artery, bypassing the stenosed patch. Here it is grafted on left marginal artery, bypassing the stenosed patch. Here you can see venous grafts are directly connected to aorta. Venous graft veins, usually saphenous veins, are grafted onto the posterior descending artery and left marginal artery. Here venous graft is grafted on posterior descending artery. Here venous graft is grafted on left marginal artery. Arterial graft, the left internal mammary artery is grafted onto the left anterior descending artery. This is left internal mammary artery. It is grafted here on left anterior descending artery. Cardiac complications, myocardial dysfunction, post-pericardiotomy syndrome, autoimmune febrile pericarditis or pleuritis, postoperative cardiac tamponade with cardiogenic shock, bypass occlusion, arrhythmias, mediastinal complications, postoperative acute mediastinitis, mediastinal hemorrhage, other complications resulting from sternotomy, for example wound infection, sternal dehiscence, sternal osteomyelitis, postoperative renal failure, neurologic deficits and coma. Outcome and prognosis. Prognosis following CABG depends on a variety of factors such as anatomical location and severity of the stenosis, presence of comorbidities, patient age, and preoperative levels of activity. Successful grafts typically last 8 to 15 years and provide an improved chance of survival, decreased 5-year mortality, especially in patients with triple vessel disease. Further progression of arteriosclerosis may still occur after CABG, as a coronary bypass is a form of symptomatic treatment and is not curative. Hey guys, like, comment, share, subscribe. Thank you.